Hello everyone, myself I am Dr. Sudheer K.V from the Department of Psychology. Now I am going to explain about prenatal diagnostic methods. What do you mean by prenatal diagnostic methods? Prenatal diagnostic methods or procedures are the clinical procedures which helps the couples or the individuals who are aspiring to have offsprings or kids. So it will be a guide for these kind of individuals. So this prenatal diagnostic method is very useful in detecting abnormality at the womb. So it would be very helpful for the couples. So here the purpose is to detect the anomalies which are present during gestation period or during the womb period, that is total 9 months and 8 days. So there are 5 major or significant types of prenatal diagnostic procedures. Let us see what are those one by one. The types of diagnostic methods. First one is amniocentesis. What is amniocentesis? It is a widely used technique wherein the amniotic fluid from the amniotic sac is extracted through the uterine and or the abdominal wall, and it is tested for abnormalities or anomalies. Most of the time this diagnostic procedure is performed around 14th week after conception or getting pregnant. So there is a risk of miscarriage associated with amniocentesis. The next important procedure is chorionic villus sampling. What is chorionic villus sampling? It is another significant procedure in which the chorion or the villi or the hair-like structure which is at the external side of the growing embryo or fetus is taken or extracted through the uterine wall, and it is studied after 9th week of pregnancy or conception. The genetic linked abnormalities or any kind of physical defects can be detected. However, if it is carried out frequently, then it would be leading to a miscarriage condition. If it is carried out frequently, then it could lead to miscarriage. So a chance of heavy risk associated with this is miscarriage. So this method is less preferred compared to amniocentesis. Next, going to the next method, that is called as ultrasound, very commonly used in most of the countries. So here the device that is used is high frequency sound which is projected over the uterus, and the video or the images of the fetal activity that will be scanned and that will be picturized in the screen. So in the monitor it is very easy to detect the facial structures, physical or overall physical growth, heartbeat, pulse rate, size, shape, structure of the baby, its laying position and other physical activities, growth of the internal organs, everything can be detected with the help of ultrasound. So it is one of the very commonly used method, and here if it is used more than 5 times, then there are chances that the baby can have less birth weight. Going to the next type of diagnostic procedure, fetoscopy. What is fetoscopy? Fetoscopy is a clinical procedure or diagnostic procedure in which a tube with a small light will be inserted into the uterus, and it is performed between 15 to 18 weeks after pregnancy. Here the facial abnormality, internal organ diseases or any kind of spina bifida or mental retardation or any other cerebral palsy conditions or any other cerebral palsy conditions can be detected very easily with the help of fetoscopy. And next procedure, that is called as maternal blood analysis. Maternal blood analysis is performed in the initial stage after pregnancy, so that is around within 2 months after conception. If the couples want to know quick result, want to have the quick result within few months after pregnancy, then this is the best method, that is maternal blood analysis. So when the fetal body emerges into the maternal blood, a small sample of maternal blood can be extracted from the womb or uterus, so that the presence of alpha fetoproteins can be detected, and it indicates the abnormality of any internal organs. The amount of alpha fetoprotein which is present in the womb, that exactly reveals the extent of damage to the internal organs of the developing embryo or fetus. So this could help the pregnant lady or the couples to detect the presence of any handicappedness in the initial stage itself, so that they can go for either abortion or they can decide for other clinical procedures. The last type of prenatal diagnostic choice or procedure is pre-implantation genetic diagnosis. After conducting in vitro fertilization or test tube based fertilization process, the fertilized egg which is present in the test tube, from that a small portion of the external layer or the tissue will be extracted, and that is studied before implanting it to the maternal womb. So this will help the medical practitioners to verify, diagnose and decide whether to implant the fertilized egg or not. If there is any genetic linked risks are associated in the development of the fertilized egg or zygote, then definitely they can think of not having the baby at that time or not to implant the fertilized egg. So this is very helpful for the couples to avoid risks. So if it is performed, there are chances that the developing embryo after implantation may develop some physical abnormality due to the damage of the external tissue. So this is about prenatal diagnostic procedures or methods. Thank you.